High Nights Media Network. I'm your host, Katie Rowland, and today we're here with Dr. Leslie Leffler and Vince the facility dog. So just jumping right into it, do you just want to explain to the audience so we have like a little bit of a better understanding what a facility dog is?
Sure. So a facility dog is a type of service dog, and so he was actually trained by the Kentucky Correctional Institute for Women out in Pewee Valley, which is the women's prison. And he was actually trained to be a service dog with a disabled person, but there's really a big push towards having facility dogs. And so we can talk a little bit about what he does, but his roles are a little bit different than serving one individual person. He really is here for all of us. And so we've had to teach him some new things. We've had to deconstruct some of his things, like only being with one person and paying attention to one person. He now goes and visits people and things like that. Mm-hmm. So he's actually held to a higher standard than a service dog, but he has to do all the things that a service dog can do, but also be really social and do some tricks and things like that.
Yeah. Awesome. So how long has that training been going on?
So they start training actually when they're about 3 weeks old. They can sit, and then the bulk of the program starts at 8 weeks. So he just turned 2, so he's been training pretty much his whole life to be a service dog, and then again a facility dog. And he can hear me whenever I get in his little treat pouch, so he immediately pops his little head up. So he's very, very cunning when it comes to cookies, so he'll do just about anything.
I bet, And what breed is he again?
So he is part lab and part golden retriever. So his dad was a golden retriever and his mom was a Labrador retriever. And so he was actually bred very specifically for intelligence and temperament. And they did a lot of genetics because labs tend to have problems with their hips and eyes. So he actually goes to a specialist once a year to check on all that. But he was bred down a line up to a very famous guide dog. So he's in that bloodline, kind of a champion service dog bloodline. So,
they're kind of like made for
very
this.
Intentional. For sure. This was his whole purpose.
Yeah. So like switching from what he was originally supposed to be, like a service dog versus now like a facility dog, did that training have any was it hard for him at all to kind of like switch that role, or like how did that go about?
Yeah, so some days it's harder than others. So a lot of times he focuses on me as if we are very bonded together. So he will sometimes focus on me like I am the disabled person. Mm-hmm, so sometimes I will send him to go say hello to someone and they will pet him, but he immediately reverts back to me in the heel position. So just trying to get him to relax, and it really just takes practice. We've also taught him some additional tricks to interact with students and faculty and staff. So one of the things he does, which I should have brought it with me, but he has a basket that he puts in his mouth. If you've seen him around campus, then he gives out stickers of himself. Aww. So other than it's kind of funny. They're really cute stickers. So. And he's really, really good with the basket. So just teaching him special things that he can do to interact with people. Facility dogs are also used throughout the city of Louisville and really around the country. Facility dogs, there's 13 dogs like Vince from the same organization, Paws with Purpose, who did all of his training. 13 dogs at Norton Children's. There's dogs at the University of Louisville Hospital. And so the dogs do a variety of things with child life development, where they will go in and say at the pediatric hospital, there's a dog in pediatric oncology that will go and lay in the bed with a child while they're getting chemotherapy. Or if they're having trouble getting up and walking, the dog will come and they have a special leash where they can all walk together. Or if they're not taking their medicine, we can give the dog like medicine in a syringe, and then the child wants to take the medicine. So we're actually using him in the pediatric simulation. We'll be in a simulation later today with our nursing students as we're preparing them to work with facility dogs as they go out in the workforce, because it's actually very common that you have these canine therapy dogs and service dogs in the hospital setting.
Yeah, I was going to ask about like the local hospitals having dogs in there. So you're basically saying that a lot of hospitals are implementing these kind of dogs now?
Yeah, so actually every hospital has some form of facility dog. Baptist has a slightly different program, and it's called WAGS. So it's a different organization. Those are people that train personal dogs to come in and interact with the patients in the same way. This is Paws with Purpose. They're actually an internationally credentialed service dog organization, so they're held to a much higher standard. So all of the dogs at Norton, I think aside one, is all from Paws with Purpose. Yeah.
That's awesome.
Yeah.
So did Bellarmine choose to have Vince as a facility dog like in the last like year or two, or like when did they choose to like want to have Vince on?
Right. So it all started with Dr. Gabri Warren had a nurse camp. And that's where we have a camp for grades 7 to 9th, high school students. And so one of the things we did to engage the students is we had Paws with Purpose come in and bring a dog. And so Dr. Warren came to me and she was like, oh my gosh, this dog is amazing. They use the dogs in the hospitals. And I guess I was the only person crazy enough to think, yes, let me commit for the next 10 years to have him live with me and train me, or me train him, and further his training. Really, he came to me trained, and the women at the prison taught me how to speak his language, and so now here we are. We have a kind of a benefactor in place to cover the costs, and so here we are.
Yeah.
And so we've been together really not that long. I started training a year ago. We started training together at the prison in March, and then he came to Bellarmine for the first time in May, and we've been together full time really for the last 3 months. So really we have not been partners very, very long. They say that until we've been together a year, that's when you kind of know you've bonded and everything is usually at its best.
Yeah. So he lives with you like at home so like after school he just goes and
so he goes to meetings with me. We come in, I check my email. He takes a little post breakfast nap because that's what he likes. So he's got lots of toys. He's actually got 2 beds in my office. One's under my desk. He likes to be close to me, and then one is out in the office space with me. So he'll take a nap while I kind of get oriented to the day. Then he'll go with me to meetings. We do simulation. We go to recruitment events. We will go and greet nursing faculty and students in the hallway. So I want to implement maybe like a happy hour where we can all meet maybe in a classroom, or trying to teach him right now how to take selfies with people. And so that's super fun. So he does a lot of things, but he brings a lot of happiness not only to our nursing students, but students around campus, our faculty, staff, in addition to all his other duties that he does around the university.
So if students were to want to go meet Vince, like where would they go for that?
So he lives in Miles Hall with me as far as when we're not at home. And he is there the majority of the time. A lot of times you'll see us walking around. I also have 3 daughters on campus. One of them did the training with me as a service. She's a commuter and still lives at home. So you may see her walking around campus. Her name's Allison. She's always happy to let you interact with the dog as well. So we will walk around campus, and then of course there are times that we're training, and so I tell people, sorry, we can't interact right now. But people can always ask, and we're happy to stop and talk about the dog, or have the dog give you a nose bump or whatever. He does all sorts of things. So.
Does he work anywhere outside of Bellarmine, or is it just here, like training with you?
So he works here with us, and all of the duties that he has here. It's really important from an obedience standpoint that he be bonded very solidly with one person, and that really comes through, obedience comes through bonding, and then love and relationship through us. He wants to make me happy. He wants to make students happy. So he loves nothing more than when people see him on campus and want to interact with him. So he gets really happy about that.
Well, you said he can do some tricks. Can he try to show us some of his tricks he can do?
Vince, sit. Oh, sorry, we have to stretch. Stretch first.
He's tired.
Sit. Vince, wave.
Oh.
Good boy. Let me give him a little cookie. And then put your fist up like you're going to do like a fist bump. Vince, nose bump. Good boy. That's such a good
He's so
boy.
adorable.
He's such a good boy. Let's see, what else, buddy? Vince, leash. give. Yes. So he'll give me his leash and other items. So
Yeah.
and he does all sorts of things.
Yeah.
So.
Well, I guess that he's still in training a little bit. He's going to continue to learn more things.
Yeah, so we're always training. Sit. We're always training, always trying to learn new things, and we'll continue to grow his skills. And then he's officially a service dog. He's got his red vest, but we'll just continue to grow and learn.
Yeah. Okay, well, awesome. Thanks for talking with us.
Absolutely. Thanks for having me.
Thank you.